It was a busy day on Capitol Hill yesterday because the former head of the Centers for Disease Control and Prevention, Susan Menarez, testified in a closely watched hearing just weeks after her firing by HHS Secretary Robert F. Kennedy Jr. last month. NBC News correspondent Ann Thompson has that report.
I believe preventable diseases will return, and I believe that we will have our children harmed for things that we know they do not need to be harmed by. Polio, measles, diphtheria, whooping cough.
The stakes laid bare by fired CDC Director Dr. Susan Menarez over the future of the nation's vaccine policy. In August, 29 days after he called her scientific credentials unimpeachable, Health and Human Services Secretary Robert F. Kennedy Jr. dismissed his handpicked Senate-confirmed choice over vaccines.
He just wanted blanket approval.
Okay.
And if I could not commit to approval of each and every one of the recommendations that would be forthcoming, I needed to resign.
Menarez told the Senate committee she refused to pre-approve the decisions of a vaccine advisory panel without science or data. Several new members of that committee, selected by Kennedy, share his vaccine skepticism.
I was fired for holding the line on scientific integrity, but that line does not disappear with me.
2 weeks ago, Kennedy told another Senate committee Menarez lied about her firing.
Medicaid will tell the head of the CDC that if she refused to sign off on your changes to the childhood vaccine schedule, that she had to resign?
No, I told her that she had to resign because I asked her, are you a trustworthy person? And she said no.
Menarez also said Kennedy disparaged the nation's top health agency.
He called CDC the most corrupt federal agency in the world, emphasized that CD employees were horrible people. He said that CDC employees were killing children and they don't care. He said during the COVID outbreak, CDC told hospitals to turn away sick COVID patients until they had blue lips before allowing them to get treatment.
Menarez said Kennedy's assertions are not true. Some committee Republicans zeroed in on the COVID vaccine.
Does the COVID vaccine reduce hospitalization for children under 18?
It can.
It doesn't.
Doctor and committee chairman Bill Cassidy wants to hear from Kennedy himself.
I think Secretary Kennedy has to come and address this specifically.
Thanks to NBC's Ann Thompson for that reporting. It sets us up nicely for our conversation with senior healthcare reporter for Politico, Alice Miranda Olstein. Alice, you were watching that hearing. I was toggling back and forth between that and the Kash Patel hearing on the House side. I mean, what stood out to you? There was a lot of news made yesterday.
Absolutely. So I was in the room when Menarez really tried to say, this isn't about me. This is about the broader attack on public health. My firing is just one of many things she finds scary happening at CDC right now. But she was saying, you know, while I'm here, I'm going to defend myself and stand up for my reputation and sort of fact check the things that Kennedy said when he testified before Congress recently about her and about what he was up to. And so she was saying, you know, I was asked to do unethical things and basically fired for refusing to do them. Those unethical things include firing, you know, career expert scientists at CDC and leaders. And also, she was asked to pre-approve decisions made by this vaccine advisory committee that's going to be meeting today and tomorrow without having seen the evidence first. And she said, you know, I just couldn't, I couldn't handle that, and that's why I was fired.
And so as we're tracking the fallout of the firing, you still have these kinds of actions taking place. I mean, you have the Vaccine Advisory Board meeting today. And it reminds me, I think, that you watch a hearing like that and you see that there are so many layers to this, right? She's defending her personal credentials. There's the political pieces of this of, OK, Kennedy might have to come back and testify. A lot of us were watching Bill Cassidy, who holds this really fascinating place as a Republican who will have to defend his seat in 2026. But he's also a physician. He's clearly concerned about what he's seen from Kennedy. And then, of course, there's the public health impact of it. Can you take all of those together? It's no small task. Right. And just talk about the impact of that. I mean, it's not just personal and political. People, kids, could be harmed by the decisions that are made here.
Absolutely. So the whole hearing was about who is making decisions at CDC and what are those decisions based on? Are they based on ideology? Are they based on medical data and scientific evidence? And these two former CDC leaders who testified were saying that, things have been completely politicized, that they and others have been muzzled, barred from speaking to Congress, barred from speaking to their own career staff, and again, asked to do things related to vaccine policy they felt were unethical. And they also said they were completely bypassed in decision making, where, Kennedy would just announce things on social media that that weren't cleared with them, that weren't based on evidence. And so what you said about Cassidy is exactly right. He, chairing this hearing, was in a very interesting position where often he was pushing back on his own Republican colleagues and the things they were saying at multiple points in the hearing. And he kept invoking his own credentials as a doctor who specialized in liver in hepatitis, because that is one of the top things the vaccine committee will be discussing, this hepatitis B vaccine for newborns.
What do you ultimately predict that the vaccine panel is going to put out here?
So for context, this panel was completely remade in Kennedy's image. He fired all of its members earlier this year and replaced them, including with several, known anti-vaccine activists who, have been part of these advocacy groups that have been suing pharmaceutical companies and putting out misinformation. And so there is a lot of concern. It came up at the hearing a lot that this panel will recommend fewer vaccines be approved for both children and adults. Now, it is just an advisory panel. They're not the ones, making the law, but what they advise, if upheld by, HHS and CDC, could dictate which shots are covered by insurance, whether pharmacies stock them or whether they're afraid of, legal liability, et cetera.
Yeah, it's the biggest megaphone for public health in this country. It's why there's so much concern about it. And hearings like this yesterday put a spotlight on why that concern exists at a time where we're seeing vaccine mandates be rolled back across the country. All of this very much a live ball that we'll continue covering. Alice, appreciate you coming on and talking about it. You've also got some great reporting online that we'll double back to and make sure to read as well. And still ahead.